So I'm going to be discussing a water birth and what that essentially means. Basically, it's just for you to go through a water birth for women who are pregnant. It just means you can do your labor and delivery in water, or just part of your labor and just deliver on a bed. It just depends on what you're comfortable with and what your doctors are comfortable with for you to do. This is according to WebMD, and also according to WebMD, your water birth can basically just be at a hospital, a birthing center, or at home. Depends on where exactly you want to be, what you feel more comfortable with. Um, People that are going to be there is going to be a doctor or a nurse midwife or just a midwife. It just depends where exactly you're going to be and the setting for where you decide to have your child at. Not only that, WebMD also said that the use of a birthing tub is going to help you with easing the pain. It's also going to help you with keeping you from needing to use as much anesthesia as possible, depending if you want to go natural without medication or if you want to use medication at some point to ease pain. And it also helps you speed up your labor as well, so you're not in labor for however long some babies decide to take, or if you're on your first baby, or if you're on baby 2, 3, 4, or 5, or whatever, how many kids you have at the time of this labor. You're also going to want to make sure that wherever you have it, especially at a hospital, they're going to offer the birthing tub for you to use. Check your local hospitals around you, depending on where you decide to have your labor and delivery at. Local hospitals close to me, for those of you that are close to me, Akron General and Akron City both offer you to be able to use a birthing tub. You're also going to need to talk to your OB as well about how comfortable they are about you doing a water birth or the labor. My OB personally will allow me to labor in the water but not deliver because of risk of infection. And, there's, to me and to the baby at least, and they're okay with that. They're comfortable with it. So just check with your OB. Just also discuss your labor and delivery plan as well, because just because you're comfortable with it may not mean the OB is. So just make sure that you iron out all the kinks that you have in the way of doing your labor and delivery. That way, all your bases are covered.